All right, so you've just had your lower blepharoplasty with fat grafting done here with us at Visage. So I'm going to go over those post-op instructions with you. So when you go home, we're going to give you a care kit. In the care kit, you're going to have some Aquaphor, Arnicare, and ice packs. So I'll go over how to use these in the video. Immediately after your procedure, you can start icing the area if it's feeling tender. Where we graft the fat from may be tender, so you can ice there as well, whether that's your abdomen or your thigh. Bruising and swelling is going to peak around that first 24 to 36 hours after your procedure. So to help with this, icing the areas as well, just making sure with the ice packs you're wrapping them in cloth or some sort of barrier so that the ice isn't directly touching your skin. To also help with swelling in the face, so you can sleep elevated at a 30 to 45 degree angle. Doing this for the first 5 to 7 days after your procedure will help to minimize the swelling. You're going to have a small incision site where the fat was grafted from, so whether that's at the belly button or on your thigh, this area will have steri strips on it, so just leave the steri strips on until they fall off on their own. If they happen to get wet, you can just pat them dry. If they come off, then this is when you can start using the Aquaphor ointment. So just applying the ointment twice a day to the small incision that you're gonna have there. Generally with this incision, there's no suture. It's just gonna close on its own. So you can start cleaning the area once those steri strips fall off with a mild non-scented soap and warm water, and then patting it dry, not rubbing the area, and applying that ointment. For pain-wise, so if we prescribed you something for pain, you can take that. Otherwise, Tylenol or Tylenol extra strength are great options. We just ask that you don't take any non-steroidal anti-inflammatory drugs like Advil or naproxen for the first 5 to 7 days after your procedure, as these can increase your bruising and swelling. Things to look out for, it's going to be signs of infection, so any increased redness, tenderness, swelling, drainage that's like a pus-like or foul smelling. These are things that we want you to notify us of so we can take care of that as soon as possible. So during regular hours, you can contact the front desk. Otherwise, a provider who would have called you for your pre-op phone call would have given you their number. So if it's in the evening or on the weekend, you can always reach out to them. If you happen to go to the emergency within the first 14 days after your procedure with us for something not related to what you had done with us here, we just ask that whenever you get a chance, you give us a call so that we're up to date on your health. And for showers, so you can start showering 24 hours after your procedure with us. Just making sure that your shower is lukewarm, it's not too hot, and there's not a lot of steam, as this will increase your swelling. Please make sure that you're not soaking the incision site for at least 4 weeks. We want to make sure that that's fully closed. So no swimming, no taking baths, and no saunas for 4 weeks. Under your eyes for the lower blepharoplasty, there's not going to be an incision on the outside. It's on the inside of the eyelid. So there's not going to be any sutures that need to be removed there. That's just going to heal and close on its own. So if you do wear eye contacts, please wait at least 1 week before putting those back in, unless otherwise directed by us here. Thanks for choosing us for your procedure, and happy healing.